So we'll be start we'll be starting with the psychiatric illness and drugs for psychiatric illness. Mm-mm. Yes, psychiatric illness. It's a interesting topic. So there are two types of psychiatric disorder, like psychosis and neurosis. So psychosis is in which patient is not aware of his illness. So insight is absent. Like the conscience, uh, the person doesn't know that he is ill or sick. Psychosis is that, and refuses to take treatment. Also, it includes major psychosis like schizophrenia, as well as mood disorders like mania and depression, bipolar disorders. Depression, mania, and all of that. Depression and mania together are bipolar disorders. Neurosis is it's less severe, and anxiety is present. Obviously, it includes anxiety. Anxiety is neurosis, and depression is psychosis. And anxiety, obsessive compulsive disorder, obviously, and phobias are there, and eating disorders there, and post traumatic stress disorder is also there. So a lot of things are going on. Uh, Now, psychiatric illness, they have made a table. Psychiatric psychosis and insight is absent, obviously, and neurosis insight present, OCD, phobia, anxiety, PTSD, and bulimia. Insight is absent in this, and insight is absent actually, not inside. Schizophrenia is there, affective disorders like mania, depression, and bipolar that we learned. Now they have straight on jump to the drugs. Mm, Antipsychotic drugs. So, schizophrenia is severe psychiatric illness and is thought to be due to dopaminergic overactivity. So, what they're saying is there is dopamine and axis. Mm, Sorry, excess. What did we learn where dopamine was less in quantity? It was Parkinsonism, right? In the and also in the limbic system, not just anywhere in the brain, but in the limbic system, there is dopaminergic overactivity and other neurotransmitters like 5-HT is serotonin and Na is norepinephrine or noradrenergic neurotransmitter. Also, probably plays a role in the disorder. And all of the drugs of schizophrenia have equal efficacy and they mainly different potency. Only the potency is like different, but they are equal in efficacy and they can be classified as D2 blockers. So we are giving D2 blockers here, and their atypical could be typical and atypical, which is acting via the mechanism. And so we have antipsychotic drugs. There is typical neuroleptics and atypical antipsychotics. So typical when they block the D2 receptor and they have high D2 5-HT2A affinity, which is like serotonin only. Reading this is raising my heartbeat. Mm, mm. Phenothiazines. We have phenothiazines, we have thioxanthines, we have butyrophenones, phenothiazines, thioxanthines, phenothiazines. We have thioxanthines. Then we have butyrophenones. phenols, and we have miscellaneous drugs. So we have chlorpromazine. Chlorpromazine, have I read chlorpromazine somewhere? I think metoclopramide. Okay, fine. Chlorpromazine, this thioridazine, trifluoperazine, flufenazine, then flupenthixol, and thioxi- thiothixine. Now butyrophenols, we have haloperidol. Haloperidol, we all know, droperidol, and penfluridol. These all we know. Pymoxy, pymozide, loxapine, molendone. This atypical we have clozapine, olanzapine, quetiapine, risperidone. I I don't know. I think iloperidone, paliperidone, ciprasidone, lurasidone. So if I can pine, done, zol, ठीक है, don, aripiprazole, acinapine, certain dole, zotipine, cariprazine, primavancine, and zotipine. Pine and don are one of those things. Okay, so action of the typical, they are blocking the D2 receptor and they differ significantly in potency. They have low potency drugs such as chlorpromazine. They're highly sedative, and whereas hypertensive drugs cause less sedation, there is a hypertensive drug that are more likely to cause extrapyramidal symptoms, like which is maximum with haloperidol, whereas least known with the thyroidazine. Thyroidazine इसमें है thyroidazine, maximum with this, and thyroidazine minimum with this. Yeah, now hypertensive drugs have hypertensive drugs. Hypertensive drugs, they will cause extrapyramidal symptoms. Hypertensive drugs have low anticholinergic and autonomic side effects compared to low potency. These drugs lower the seizure threshold and can precipitate convulsions in an epileptic patients also. Precipitate means they will cause lower seizure threshold means they will even on low level of stimulus seizure can occur. All of these agents are potent antiemetic, obviously. Yeah, except thyroidazine, potent antiemetic, obena, metoclopramide, and domperidone, all of those. Low potency drug possess significant alpha blocking होती है with low potency, hypotensive, extrapyramidal symptoms, and anticholinergic properties. तो इसमें they were low anticholinergic, इसमें there is anticholinergic properties maximum. Hypertensive have less activity on these receptors. Due to blockade of D2 in hypothalamus and pituitary, these drugs can increase the prolactin release. Oh my god. Galactoria and amenorrhea. So these drugs are also affecting your menstrual cycle, and they are giving you galactoria. That is because in the in the hypothalamus, everything is stimulating or releasing hormone. except the prolactin, which is prolactin inhibitory hormone. So when this is disturbed, like hypothalamus is disturbed, this production will increase. So galactoria. Actions of antipsychotic. So antagonistic action होता है. Antagonistic, that is opposite. Antagonistic 5H2 and alpha receptors पे, which is serotonin. Serotonin receptor may not process due to blocking activity. These drugs are less likely to cause experimental symptoms. However, most of these agents, except ziprasidone, and can result in weight gain, hyperlipidemia, and new onset diabetes mellitus. So remember this: hyperlipidemia, DM, individual drugs. Now we are going to do individual drugs. Oh my gosh. Yeah. Thioridazine. I think I need to have this picture in front of me all the time. So thioridazine, what we are learning about it is it has the least incidence of extrapyramidal symptoms among typical antipsychotic due to low potency. यहाँ पे भी लिखा है least common with thioridazine. It has central anticholinergic activity. It interferes with the male sexual function, inhibiting ejaculation due to alpha blocking action. Male sexual function can cause cardiac arrhythmias, prolonged QT intervals, retinal damage, limit long-term administration. There is trifluperazine, fluphenazine, and haloperidol. These are the high potency drug and have least alpha blocking and anticholinergic sedative and proconvulsant actions. However, extrapyramidal symptoms are marked. इसमें and fluridol is the longest acting antipsychotic drug. So flu, and halo. So fluphenazine, trifluperazine, and haloperidol. ये butyrophenols में है. They have very high. They have very high sedative action, least alpha blocking, anticholinergic, and sedative and proconvulsant. So they are high potency. But extrapyramidal symptoms बहुत ज़्यादा होते हैं. Penfluridol, यहाँ पेनफ्लुरिडॉल ब्यूटाइरोफिनॉन्स में है. They're actually longest acting. Pimoside actually selectively blocks the D2 receptor without affecting the alpha. Pimoside blocks this without affecting alpha. Muscarinic receptor also possesses. इसमें भी QT prolongation होता है. It carries high risk of arrhythmia. Pimoside and clozapine, though it's atypical, obviously. Antipsychotic having weak D2 effect action mainly acts by 5-HT2 alpha adrenergic and D4 receptors. So D4 D2 नहीं है but D4 receptors है. suppresses both positive as well as negative symptoms of schizophrenia. So, first FDA approved drug for anti-suicidal indication, clozapine. तो अगर आएगा क्वेश्चन कि what's the FDA approved anti-suicidal, तो ये है, इसमें पॉजिटिव एज वेल एज नेगेटिव इफेक्ट सिम्टम्स होते हैं स्किज़ोफ्रेनिया के. बोथ आर suppressed. It is used even as a reserve drug due to risk of precipitation of seizures and agranulocytosis. Agranulocytosis may be then conversion dose dependent adverse effect seen only in high doses, whereas agranulocytosis is independent of dose. Because of association with myocarditis, clozapine is contraindicated in patients with severe heart disease. So, myocarditis, the inflammation of muscles of the heart. Myocarditis, clozapine is not given with severe heart conditions, and most common adverse effect is sedation of clozapine. Most common is sedation, but ये heart patients में भी नहीं देते. And risk of extrapyramidal symptom is least obviously because low potency drug है, and it specifically has two risk of intestinal dysfunction, potentially severe ileus and sialorrhea. Now risperidone, and also 5-HT2 से होता है, alpha से होता है, D2 receptors. It is more potent D2 blocker than clozapine because may be atypical and cause extrapyramidal symptom at high doses. Risk of precipitation of seizure is less, and hyperprolactemia is there. Has been reported more commonly with risperidone than any other atypical. Its active metabolite, paliperidone, has lesser risk of causing metabolic adverse effects. Now, there are long-acting injectable antipsychotics for uncooperative patients. So, haloperidol तो सुना ही है सबने. Decanoate, fluphenazine decanoate, and haloperidol decanoate, risperidone microspheres, and paliperidone palmitate. So, this is actually active metabolite only. Paliperidone, risperidone, active metabolite. Olanzapine also atypical, no? It has similar mode of action as risperidone. It is also a potent anticholinergic and can cause dry mouth and constipation. So dry mouth and constipation. And can cause seizures and weight gain. Weight gain तो होता है with every this thing, you know. Apart from its use in the schizophrenia, it is used in acute mania and bipolar disorder. It has been associated with significantly higher risk of stroke and death in elderly patient. So it should not be given in elderly patients. Ziprasidone it causes QT. तो हमने अभी तक क्या क्या देखा है? It can cause weight gain, QT prolongation, and then can cause some QT prolongation तो देखा है. High risk of arrhythmias. It's not also like heart conditions में clozapine is not given because myocarditis होता है. This is ziprasidone. Hypolipidemia. So diabetes में भी नहीं देते हैं. All of these drugs. However, ziprasidone it's not associated with weight gain, hyperlipidemia, or diabetes. Otherwise, these antipsychotic drugs they are actually associated with all of these things, all of these three things. Quetiapine is actually cataract formation. It has the shortest half-life also. Aripiprazole acts by 5-HT1 D2 receptor, okay, 5-HT2A, also known as dopamine serotonin stabilizer. It has a long half-life and can also prove it has been proved for treatment of irritability associated with autistic autistic disorder in children. Irritability. To aripiprazole. Hmm. Wow, what can I do with this? Wow, nice. So autistic, if there is a question about autistic, then aripiprazole can be given. Acinapine is actually used sublingually for schizophrenia and acute mania, but you have no insight. Schizophrenia, mania. Acinapine sublingually use करते हैं, and also ilo iloperidone. It has less risk of extrapyramidal adverse effect, but it can cause orthostatic hypertension, cause QT interval. हमेशा ये होता है, QT interval prolong हो जाता है. Brexpiprazole and cariprazine are newer drugs to approved for schizo, and pimavanserin is a new atypical antipsychotic. It is indicated for oral treatment of hallucination and delusions associated with Parkinson's disease. Effect adverse effect sedation maximum with chlorpromazine max and minimum with azaprasidone. And aripiprazole weight gain is there. Sedation is yeah, sedation maximum of chlorpromazine. Yeah, right. The most common adverse effect was I think clozapine का था वो. हाँ, sedation. Most common adverse effect sedation. Now there is obviously precipitation of the seizures and postural hypertension is there. Inhibition of ejaculation because of the alpha blocking property. ये किसमें था मेल. तो फर्स्ट एडवर्स इफेक्ट था शायद से या इसका thyroidism हाँ. weight gain with except haloperidol. Atypical antipsychotic may result in weight gain, hyperlipidemia, and diabetes, except ziprasidone, according to their potential to adverse. High potential is clozapine and olanzapine. So low potential are risperidone, paliperidone, ziprasidone, quetiapine. तो high potential याद कर लो बस clozapine और olanzapine. And low potential तो obviously risperidone, paliperidone, जिसका यही है. ये इसी का active metabolite है. Paliperidone is active metabolite of risperidone. बाकी so least retinal degeneration होता है with thyroidism. Okay. Agranulocytosis, cataract formation with quetiapine, and cholestatic jaundice with chlorpromazine, dry mouth, blurred vision, constipation, urinary retention, hyperprolactinemia, amenorrhea, and galactorrhea. D2. Extrapyramidal symptoms like related to antipsychotic of typical, yes, just me, low potency, typical का low potency था. Hmm. Acute muscular dystonia. Acute muscular dystonia, it is the earliest appearing symptoms within hours and may manifest as torticollis, lockjaw, and oculogyric crisis, a spasm of the other muscle. Central anticholinergics are useful in the treatment. Within hours, acute muscular dystonia. Parkinsonism 1 to 4 weeks because हम इसमें anyway ब्लॉक कर रहे हैं D2 एंड पार्किंसोनिज्म का फीचर ही यही है कैरेक्टरिस्टिक की उसमें डोपामीन कम होता है बॉडी में देन इट कैन कॉज बेंजेक्सोल इज अ ड्रग ऑफ चॉइस फॉर ड्रग इंड्यूस्ड बेंजेक्सोल दे सकते हैं इट्स अ ड्रग ऑफ चॉइस फॉर ड्रग इंड्यूस्ड पार्किंसोनिज्म सो सो इन सब ड्रग्स इन सब में एंटीसाइकोटिक्स में एंटीसाइकोटिक्स एंड द ड्रग्स उनसे होता है ड्रग इंड्यूस्ड पार्किंसोनिज्म तो बेंजेक्सोल इज द ड्रग ऑफ चॉइस फॉर दैट काइंड akathisia it's an irresistible execute ठीक है I have 2 minutes it's an irresistible desire to move about in absence of anxiety it's a common extrapyramidal symptom akathisia cigarette smoking associated with increased risk of akathisia propranolol is the preferred obviously anxiety नहीं होता है but you have to like keep just desire to move irresistible desire to move so propranolol usually it calms you down. However, central anticholinergics are useful in the treatment. Malignant neuroleptic syndrome present as hypothermia and extreme generalized rigidity, autonomic instability, and altered mental status can be treated with dantrolene and bromocriptine. Tardive dyskinesia, हाँ ये तो उससे हो रहा था valproate से latent therapy and is characterized by purposeless involuntary movement like chewing or puffing on the cheek. The involuntary movement on the jaw. It is assumed to occur due to supersensitivity of dopamine receptors. Central anticholinergic are contraindicated. Mm. Valbenazine, a VMAT inhibitor, is approved for tardive dyskinesia.